taking a look at the issue of Medicaid expansion, when the nonpartisan Fiscal Bureau is saying it would cost the state less to adopt the full expansion, how is that not the more fiscally responsible move?
Yeah, I mean, what you're talking about is the federal government has, put more one-time money into the most recent CARES bill to try to get states to expand their welfare for healthcare. And so certainly there's, basically a federal bribe that's being put out there to expand that welfare program. But we know that there are different costs that come with that as well. We've got people right now covered on private insurance through the exchange here in Wisconsin. And we know that that private insurance gives them better coverage and better payments to our health systems. And when we take people off private insurance and put them on the welfare program, that's going to have a negative impact on how these healthcare providers are paid, which then requires private pay and private insurance to make up the difference. So we're going to see, rates go up for other folks. And it's not just as simple as how much federal money can we get if we put more people on welfare. It's a much more complicated issue than that.
In terms of just being a steward of the taxpayers' money, when the Fiscal Bureau says going back to 2014, it would have saved the state a total of $1.6 billion by doing that full expansion, simply by covering those childless adults up to 138% of the poverty line. You would be spending less money to cover more people.
But those people have coverage now on the private insurance, which we know is better for our system, for our health systems, better coverage for those individuals. And so we're focused on healthcare, healthcare outcomes, health insurance coverage, not just on how much federal money we can bring into the program and how fast we can grow this welfare program.